Hey guys, Dr. Charlie Ware here, your leading expert in chronic pain management and other diseases as well. I want to talk to you today about just depression. There's a lot of information swirling around, a lot of things going on with a lot of patients here locally, and I see online constantly. And I want to just get some information out there concerning my ideas of research and things that are sort of surround the whole depression thing. So let's go ahead and jump into what depression really is. And to be honest with you, lots and lots of individuals have different stages of depression. Depression isn't something that is chronic or is constant in everyone. Everyone has a situation that they can mull over or be in a depressive state for a period of time, but then they also move on. I'm talking about the individuals that because of their condition, they fall into a depression. Or even throw out there, even a caregiver that has to take care of an individual that has a chronic pain or chronic disease situation, that they also may also fall into depression as well. Depression, honestly, is something that it can be something that's chemically induced or also emotionally induced, or it can be a combination of things as well. There's been a lot of research linked to the fact that like use of opioids or use of narcotics, use of even marijuana and also alcohol can lead to anxiety and also depressive conditions as well. So, like I said, there's a lot of information out there. So I just want to get to the root of what the reason I'm talking about it today. I'm talking about it because of the fact that I know a lot of patients out there that I speak to either online, that sends us questions, that private messages to us, things of that sort. They want to know when would they get out of depression, or why is this happening to them. In a chronic state, there's always an arc that we speak about when it comes to medicine. We talk about anything from the realization that this situation that they're in may never end, the realization that sort of sits in the individual, the state the person's actually in now, will not be a day or a week or whatever. And it can be even an acute situation. It doesn't have to be a chronic pain situation. I know some individuals that unfortunately broke an arm or broke a leg, and they're out of their sport or not with their friends or not doing their regular activity for about 4 to 6 weeks or maybe 8 weeks, and they also become depressed as well. But again, those are emotional situations, and then we see other situations where individuals that do have chemical imbalances and may need a SSRI or different anti-anxiety medications to make sure that they're getting the right chemical balance, to make sure that they're not in a chronic state of depression or anxiety as well. So those are some of the conditions that we deal with on a daily basis, and we have to sort of tread on very light waters, sort of say not to over medicate anyone or under medicate anyone. And since I do things from a naturalistic standpoint, I think I'm always at an advantage because of the fact that my first and foremost thing is not to give medication, is to give a true solution to what's really going on. Sometimes it's talk, sometimes it is doing different things to get the individual to get out of the depression state. Now let's talk about the actual chronic pain patient. Chronic pain is something that is a huge arc where, and a lot of men, we see that, or even women, but we've seen in men more recently, that a lot of individuals that when they have the chronic pain, they're always angry. And we were trying to figure out, why is this person always angry? And then we sort of realized that the person really isn't angry. They actually are depressed. And they're like, wait a minute, I'm not depressed. I'm like, yes, because if you're always angry, there's a reason why you're trying to have this emotion as a guard, around you as well. So sometimes it takes just that talking. It's not about, medication, whatever. It's about that talking and also understanding that person. Especially in a chronic pain situation where someone was completely active and all of a sudden they were, put down for a long period of time or maybe forever. When I first started medicine, I was doing a lot of, rehabilitative stuff, sports injuries, botched surgeries, car accidents, slips and falls, things of that sort. And some of these individuals were, world-class athletes, and a freak accident happened and took them completely out of the game, either for a month or a year or maybe forever. I had a few athletes that, their injury, they woke up and were like, wait a minute, I can never play again. And it's kind of hard to tell someone they can never play again. But then you talk about when you're born with a condition that creates chronic pain. That's something that is a mentality that you have to really fall into early on. And as caregivers, we have to really teach our kids about the essence of what it really means to have a chronic condition that will create pain eventually somewhere in the body. And it's about management. It's about being proactive. It's about actually have a true efficacious way of treating the pain versus just masking the pain. And that's why I say it's very important for us to be proactive. And then when the individual is in a pain state, make sure that we're able to give the tools and not just provide the tools for them, but not do the tools for them. And that's why you also got to empower each individual as well. The more you empower someone, the more they feel as if they're in control. Most individuals we see that feel as if they're depressed or becoming depressed, they feel as if they have no control of anything. So the more we can empower these individuals with the different tools, I mean, that's when a lot of research comes in. That's when you try to figure out what's best for your body, and not just as a masking agent, but as a true way of feeling better every day, all day. And that can be in the form of, exercise. I'm going to do a video series on exercises that's going to be specifically for, chronic pain patients, and more particularly for sickle cell patients as well. I'm going to do a video series on that, because I find that a lot of the sickle cell patients, they are not moving their body on a daily basis. They're so afraid that anything is going to set off a pain crisis, and they associate everything with a crisis, that they don't want to actually move their body on a daily basis. So that's another reason why they can be in a chronic pain state. So it's about educating yourself. It's about making sure that you have the proper nutrition. That's, as you always know, that's a big thing for me, is making sure you have the proper nutrition to alleviate as much inflammation, or as we call it, peripheral inflammation in the body. So you have a great, way of actually healing the body. And then is that psychological education and training you have to do to yourself to know that, some things last for a few hours, some things may last for a few days, but there's an end towards the pain. But it's, again, at a young age, we have to start to really educate, especially if you're a caregiver, educate the patient on what it really means to have this condition, what it really means to actually maintain health in this condition as well, and what health really means. I think the fallacy comes about a lot of times with sickle cell patients, when you go and you get your actual report, and it always said you have low hemoglobin. And it's kind of funny to me, because it's always, okay, it's low. And I sort of hate those reports. And the reason why, I'm like, you have sickle cell, you're gonna have a lower hemoglobin rate historically. So it's like, but when you see those figures, it's always low. It's always that anxiety that comes about, which can also bring on pain. Or you can also have individuals who don't even want to see those reports, because they're tired of seeing the fact that they're not like the normal individuals. You gotta make sure that you find health in your own way. And finding health in your own way basically means that what fits and what works for you. We've known for years and years and years that there's not one diet for everyone. There's, plenty of different diets that can work for a lot of individuals, but it's not one that's going to work for every person. So you got to find the diet that works for you. You got to find the sleep pattern that works well for you, so you won't experience pain. Sorry about that, guys. You got to find many different things that's going to really work for you, and make sure that you are going to have the most benefit out of your health. And it's your health. So that's one way to, again, make sure that you're being proactive and empowering yourself, that you're doing all that you can to make sure that you are that healthy you. And that's a really big thing for me. The more, and then from a healthcare standpoint, I find the more that myself as a physician, the more I educate the patient. And I had a 9-month-old sickle cell patient here yesterday, and the parents were just all over the place. But we were in here for an hour talking to make sure they understood everything that their child may go through, understood that, what's healthy, what's not healthy, from the standpoint of what I've seen over the course of the last, 10 plus years of being in practice. And when they left here, they were very, very much comforted that they can have a child that can actually thrive. You see a lot of our posts online that a lot of our kids who are mentored by us, they are definitely out in summer camps. They're swimming, they're biking, they're doing sports, they're doing things so they can have a normal life. So that's why I say the more proactive you can be, the more you can actually take away that depressive aspect of things as well. And it's very, very big. You know, the anxiety of even waking up with some individuals. I had an interview with a young lady like 2-3 months ago, and I haven't posted it as of yet. But, you know, her life was always surrounded by, as soon as she opened her eyes, before she even got out of bed, she popped a pain medication. So she's not even giving her body a chance to even sort of say, hey, how do I feel today? Before she even felt any sort of pain, she would have masked it automatically. So she never knew if she was actually having a pain crisis, if she actually had a pain somewhere, because she just kept masking it over and over again until her liver started to fail. And she, again, started to eventually go the natural route, which is like, hallelujah thing. I'm so glad she took that route. But that's how our conversation sort of came about. She was popping so many pain medications for so many different years because, she was trying to either go to school or trying to be as normal as possible. And she knew that if she took that pain medication, she can just make it through the day until she fell asleep in bed at night. But we don't want that for our people. We don't want that for, our kids and, our parents or our loved ones or whomever else. And I'm quite sure the people who are watching it right now, I'm quite sure you don't want that for yourself or for your loved ones as well. You want them to be as proactive and as healthy as possible with as least things in their system as well. Because again, I already said, opiates can actually lead to a depressive state because again, you're masking, slowing the brain function down, and then the brain is going to do what? It's going to start to lull, not allow you to be as intelligent as you should be, not allow you to actually have all the emotions you really should be, and then depression usually sets in, and there's a lot of research on with that as well. So I just want to make sure that you guys understand that you have to make sure that you're being as proactive as you can with everyone around you to make sure that it's taking away a lot of these cyclical thoughts that turn into depression as well. And then with the overuse of opioids, and again, I'm not blind and not saying anyone would not need an opioid or may need an opioid. So a lot of people who don't. But if you do use an opioid, make sure that it's not the way that you're doing your pain management. Pain management should definitely always start with, always say what? Nutrition, and then everything else. Give yourself a checklist on a daily basis. And actually, in the next week or so, I'll definitely post a checklist that I've had for my patients for years and years and years. A checklist that basically says that when you wake up in the morning, how do you feel? What are you going to do to make sure that, you'll be proactive with your health on a daily basis, and things of that sort. So if you make your own checklist for yourself or for your loved one, and make sure that they're on board with it or you're on board with it, and you're being realistic with it as well. This is being proactive towards not having your brain think that, okay, well, I'm in pain. No, you're checking your pain level and say, okay, I feel great. Or, overdid it last night, so maybe I need to stretch, or maybe I need to take a little extra something this, or maybe I need to drink more water. Sometimes it's just simple things that's going to get you away from having pain on a daily basis. I live in an area where the climate doesn't really change. It changes from either, 85 to 100 sometimes. That's about it. I'm just joking, but in other areas of the world, the climate change is all over the place. You can go from being negative 20 up to 100 degrees in a 3-month span. That's very, very harsh on the body. So, but you've already been in that environment, so you know what to do to take care of yourself. You know that if it's really hot outside, you got to hydrate yourself. If you know that it's really hot outside, you know it's going to be AC everywhere. You're going to sweat, and you go from hot and cold. And it's funny because, again, a lot of people don't realize that there are just as many colds and flus that happen in the summer that actually happen in the winter as well. But again, it's more so how people sort of perceive things. But again, you got to be careful with all those things, making sure that you know what vitamins and minerals you need to have in your body to actually stay healthy. And again, I started this off as a depressive thing, but again, all these things, not being proactive and not knowing how your body is functioning, gets people to feel as if they're out of control. When you're out of control, you feel what? You feel as if you don't have any hope. When you don't have any hope, that's when you start to get more depressed. The more hope you give someone, the more hope you give yourself, the more hope that I'm able to actually add value to your life, because I'm trying to give as much information as I can to you. I'm hoping that depression is like, oh, well, I can beat this. Yeah, you can beat this. And it's only a season. It's not the way you're going to be for the rest of your life. Even if you say that, I've had pain for the last 15 years every day. I woke up with a certain amount of pain. Let's talk about that. How can you improve that? But if you don't have that conversation with yourself or with someone else, how do you expect to actually get better? Or how do you, expect, for your child to get better if you're not doing all the little steps, and then you're just masking, You want to mask. You want to actually be proactive in doing that. And there are plenty of ways to actually do it as well. So, those are just a few of the things that I think about on a constant basis, because when I speak to patients, either here in my office or I do a lot of virtual calls as well, I ask about the mental health. I want to know that everyone's on board, for one, because it's a big ordeal. And it's either if I'm dealing with sickle cell disease, diabetes, cancer, whatever I'm dealing with, I have to make sure that everyone's on board, because everyone that's involved with this person is going to play a certain role with that person emotionally as well. I've had in situations where, mom and daughter, or mom and father have arguments right in front of me because of the fact that, they're trying to figure out who's supposed to be doing what, or you causing this, you causing that. And it's not about, these emotional outbreaks. It's about basically not, it's about channeling your emotions in a positive way that makes sure that the environment's a healing environment. That's what we're trying to create here. A proactive healing environment that everyone is going to be a part of. And for me, everyone's talking about optimizing health. I don't want to optimize your health as of yet. I want to make sure you have these simple health upgrades in your life, whether it is drinking a better quality of water, whether it's taking a better quality of medication, whether it's having a better quality of mental health, that's going to make sure that you're upgrading your thought process so you won't have depression. And we see that, when you have chronic depression, that sort of puts you in a loop that you have chronic depression, chronic pain, you're trying to figure out which one we can deal with, because these medications play off each other very, very gravely. So I want to make sure that you guys stay healthy as well. And I see a lot of you guys are actually on board. I see Mr. Kevin Sargent is on board. How we doing today? And Mrs. Abby. How we doing, Abby? Haven't seen you in quite some time. And Miss Williams and Miss Hester is also on board as well. So if you guys have any questions, please feel free to type them in here. Give me some thumbs up, some hearts. And also, if you feel as if I'm adding value to your life or your loved one's life, or someone that you even know, please share this information. I'm giving this information because of the fact that when I sit in my office, or I'll tell you how this even came about. Someone I met years and years ago, her mom's actually getting her master's in public health. And she sent me a survey, which I haven't sent, but I haven't took the survey myself, but it's basically is on depression and sickle cell disease, and how this is one of the most untalked about things. But 90% of the times when you go into the hospital, you're in pain. I say 99% of the times you're either angry and or depressed because of the fact that you're in pain again and you're back in that same situation. So that's what she's researching and sort of saying, how can we improve these situations before it even gets to that point? How can we, again, improve our quality of care at home, and then also improve our quality of mental health care over a long-term basis? So if we're able to do all those things and put all those things in line, that's going to do what? Create a great environment for your healthiness to be improved and upgraded from there. Because again, something that I've been saying lately for the last couple of months is, with sickle cell disease, I don't want you guys to understand. I want you guys to understand that it is not a death sentence. It is not a limitation, because I like to live LLWL, and that stands for living life without limits. That's my moniker. That's my hashtag. I've been throwing out almost everywhere that if I put a post out, because I see too many of you guys and of us who try to put limits. Well, I have sickle cell. I can't do that because yes, you can. I have a young man, very, very brilliant young man. He's 16 years old. He'll be 17 in a few weeks, actually. He plays lacrosse. He plays soccer, and he plays water polo. Sickle cell patient. I have one. She was a captain of the marching band. She was a ballerina, the whole nine. She's a junior in college right now. I can go on and on and on and tell you the individuals that have sickle cell, and the old saying was that it has full-blown sickle cell disease, and are able to have a healthy life. Why is that? Because they are proactive in their own health care. You have to be. So some parents, hold back their kids because they don't want their kids to experience the pain, and I get it. I understand that. But you can't continue to put these training wheels on a child and then expect that same child to be an adult later on. Because once they try to go out there and live in the real world, they can't really do it. And I've seen it happen because I've had patients with sickle cell disease for the last, I think, 12 years. So I've seen a child go into an adult age, and almost every time when the parent is very overbearing and really taking care of that child the entire way, not sort of pushing them and just gently nudging them into really being proactive in their own health care, I've seen the depression. I've seen the drug addiction, to opioids. I'm dealing with two patients right now, 119 and 120, that when they turn 18, parents say, okay, you're an adult now, you need to take care of yourself, and they were in charge of all their opioid medication, and now they're addicted to it. And that's one of the rare cases, and I very rarely actually speak about that, but it has happened. So that's why I say you gotta be proactive. You gotta do all you can to make sure that you're doing enough to stave off all these emotions, stave off all this responsibility, and say, hey, look, this is your life. Let's make you have the best life as possible. Not just, okay, let me make you have the best life. Let us make sure that you have the best life possible. So that's just, something that's always been near and dear to my heart, because, I do see the attitudes a lot of times when patients first walk into my office, because, I'm another doctor that's going to tell them something that's negative, that they can't do something, that they're just going to hear something else, or try to change up a medication, whatever. But I'm here to actually just try to, again, add value and try to give you the life that you want. And so some of my first questions to my patients is always, how do you see yourself in the next 3 to 5 years? It always floors people. They always are baffled by that one question. And I ask that question because it's a mental switch where I'm like, okay, if you can see yourself in a different place 3 to 5 years from now, you can picture yourself, let's make that happen for you. So that's going to automatically do what to that whole depressive state, is to start to melt away. Because wait a minute, I can have a life? Yes, you can have a life. I can do these things? Yes, you can do these things. It's work to do it, but let's do these things. So that's the whole thing. It's making sure that you're able to do all these things, and it's not something that is foreign to you. It's something that is a reality to you as well. So like I said, that's why it's important for me to even ask that question. But it's also important for you caregivers, and also important for you patients, to really say something very, very simple. Is say, hey, look, do you want to be in pain every day, or do you want to be able to do all the things that your friends are doing? And then you sort of like put the roadmap out there. And like I said, there are plenty of guys out there. There's plenty of different ways, we can help you out, or you can actually find the actual ways yourself. Miss Williams, how you doing? Just back from Paris. I saw the pictures. I saw it, and yes, you guys were living life without limits. I saw the pictures from Paris. I'm actually jealous. I've been to Paris a couple of times, but it's only on a business trip, so I've never been able to tour. So I'm very jealous of that. So you better bring back a souvenir and send it down here to me. But anyway. But that's exactly what I'm talking about. And Miss Williams is someone that she's always asking us questions, and I actually had to put her on mute one time. I'm joking. I put you on mute. I'm joking. But she's always asking questions. She's always making sure that her child is actually being as proactive as possible. And then I'm hoping that she's educating her daughter, doing the same thing as well. And also I see Miss Forrest on here as well. The same thing. She's being very, very proactive with her kids. And actually, it's not even the fact that she's doing it. Her kids are actually more involved, or as involved as she is. She's just a moderator, and the kids were just pushing her forward just to keep going as well, because you got the whole traction behind you. And I know all you guys have the ability to do all the same things that all these parents are doing, and the reason why, because you have the strength. You have the ability, you have the wherewithal to even be inside of this group right now and listening as long as you guys can listen. I know you have the heart to want to do the best for your family across the board. So if that's the case, let's figure things out. Let's figure out how you're going to be so proactive that there's not a question about depression. There's not a question about anxiety. There's not a question about, will your child have kids and things there. So it's not a question about that. It's more so a question of how fast can all these things happen. Okay? So that's the main thing. Again, if you guys have any questions or any comments, please continue to throw them out there. I'm going to here for a little bit longer. I'm having some work done in my office today, so that's why I'm not working right now, which I'm sad about. But so I'm here answering questions and hanging out with you guys for a few more minutes as well. So, but definitely, and Ms. Williams, please post some more pictures inside of the group so we can see some of the beautiful things you guys were doing there. I saw the one where I think she was making croissants or something like that. I thought that was awesome, even though I don't eat croissants because a lot of butter is out there. But I thought it was awesome. This is a phenomenal experience. So, guys, the other thing that I was going to throw out there is a lot of times it's not just the opioids that's creating the depression or just the pain situation. It can be the lack of macronutrients, also micronutrients as well. A lot of times we have these things, these diets where no one wants to eat carbs, or carb free, carb free, carb free, carb free, and we don't really sort of realize that fruits and veggies, beans, legumes, things of that. So those are complex carbohydrates that your body needs. They have all the micronutrients, the B vitamins and the zincs and the seleniums and all these things that your body really need. When we say stay away from the carbs, we're talking about the simple carbohydrates, like the sugars and the stripped down wheat and things of that sort. So the other thing that I would tell people is, I said, honestly, you should eat as many carbs as you want to. But when I say eat the carbs, I'm saying eat as many fruits and veggies as you can on a daily basis. That's another way to actually stave off the depression. It's been shown that individuals with a healthy diet, free of toxic things of that sort, are 58% less likely to not have any depression. Or if they have depression, they can come out of it on a faster basis. Individuals that tend to be more depressed or have high sugar diets, high fat diets, and have completely unhealthy diets as well. So that's why I say, yes, it is really big for me to always talk about nutrition, because I know that it can even cause depression. It even causes something we call brain fog. Brain fog is something that people, that at one point you having a thought, and next thing you know that your thought sort of goes away, like, you can't even think properly, you don't feel like yourself. That's brain fog. A lot of times that is actually the precursor to starting to feel depressive, because of the fact that you can't think properly, you can't, assume, a thought, or even assume who you really are, and then the whole pain situation starts to flip out of control as well. So, having the proper nutrition is going to be able to keep away depression over and over and over and over and over again. Like I said, is a lot of research on that as well. So, guys, that's all I have for you today. I will be back tomorrow, back on track. Cause like I said, this was something that I was talking about because I had a patient that I've known for a long time, asked me to put out a survey form. I put it out, and I saw a lot of you guys actually filled the survey out, and they thank you very, very gravely, because the mom is actually getting that master's in public health to actually help sickle cell patients out. I think that's phenomenal. So let's keep supporting, each other. And again, if there's a need to actually have a little separate group, when we talk about, because in the African American community, because I know all of us are African American or African descent, talking about emotions, talking about how we feel emotionally is very, very taboo. So if there's a need for us to form a different group, and we can all stay anonymous or whatever, or just have that separate group, so we can actually have those conversations, let's form that group. That's one beautiful thing about social media. You have as many groups as you need, and all the groups I form is all about giving you guys the best value and understanding that we're here to actually help you out the best way we can. It's not about, again, selling your product, whatever. It's about making sure you have the best information and taking care of you the best way that we can as well. So, like I said, let's talk about the whole mental health thing and ways we can be proactive to avoid these things. And if you are in those depressive states, because again, we have some big name individuals who actually committed suicide over the last month or so, and a lot of small people here and there. I had a few patients; these are non-sickle cell related patients that either husbands or wives who committed suicide over the last year. And it was kind of shocking, because I knew these people and I knew how strong they were, but again, you never know until it happens. Like, wow, it was really that bad, but they never want to talk about it. So please, let's talk about it. Let's understand each other. Let's really, as my pastor would say, let's get naked with each other. And that's the best way to be. I'm not saying take your clothes off. What I'm saying is emotionally, spiritually naked with each other, because there's nothing for us to hide, in my opinion. So, like you said, if we need to talk about something, again, put it down there, private message me. We'll try to discuss it with you guys and go from there, right? Much love to each and every one of you guys. Like I said, if I'm adding value to you guys' life, please share this information. If I'm not, just say, Dr. Ware, shut up and go drink a smoothie or something. So, love each one of you guys. I'll talk to you soon. Bye.